Hi, I'm Anitha. I'm a speech language pathologist and audiologist. There has been an increase in the number of cases being diagnosed with autism in the recent years. Some of the causes of autism are genetic and few environmental factors. So on this day, I would like to create awareness about autism for young parents. So let's have a look at what is autism. Autism spectrum disorder. It is a neurodevelopmental disorder who have marked deficits in social communication, social interaction, and who also exhibit restricted or repetitive behaviors. It is also called a spectrum disorder because it includes an umbrella of disorders such as autistic disorder, childhood disintegrative disorder, Asperger's syndrome, and pervasive developmental disorder not otherwise specified. The term spectrum disorder also means that different people are affected differently by autism and they do not have the same overlying symptoms. Early signs. Children with autism might not respond to name call or might be inconsistent. They may not point at objects or things of interest or demonstrate interest. They may not play pretend games. They avoid eye contact and they have difficulty understanding or showing understanding or other people's feelings or their own. They have no speech or delayed speech. They can either be nonverbal or verbal. They might repeat words or phrases over and over again, which is also called as echolalia. They might give unrelated answers to questions. They get upset by minor changes. They can have obsessive interests and flap their hands, rock their body, or spin in circles. They may have unusual reactions, over or under sensitivity to the way things sound, smell, taste, look or feel, and they may also have low or no social skills. They avoid or resist physical contact. They may demonstrate little safety or danger awareness. So children with autism spectrum disorder, they have marked deficits with social communication, they exhibit restricted or repetitive behaviors, and they also have problems in sensory processing. In social communication skills, the child may exhibit difficulty in social reciprocity, that is, how the child responds and reciprocates to a situation or a person. The child may show lack of interest in topic of conversation. The child may be not taking an active role in social games and might prefer to be alone. Joint attention skill is a very important skill. It is achieved when the child alerts the parents to an object by pointing or eye gazing. And in most of the children with autism, we find that the pointing skill and eye contact are affected. Nonverbal communication. The child may not be able to use nonverbal communication and the child might not be able to understand nonverbal communication from the opposite partner. Such as, example, the child may not know that the child has to raise the arms to be carried, or sometimes the child may not understand certain nonverbal cues from parents, such as when parents frown, the child may not be able to understand that he or she is angry. And in repetitive behaviors, the child may exhibit hand flapping, spinning wheels, and lining up toys, etc. In sensory processing, the child may be over-responsive or under-responsive to stimulus that is received through our senses. How is the child diagnosed with autism spectrum disorder? A developmental screening has to be done. It is a short test to tell if children are learning basic skills when they should or if they might have any delays. Now, during developmental screening, the clinician might ask the parent some questions or talk and play with the child during the examination to see how she learns, speaks, and moves. Any delay in these areas could be a sign of a problem. All children should be screened for developmental delays and disabilities by 9, 18, 24, or 36 months. An additional screening might be needed if the child is at risk for developmental delays due to preterm birth, low birth weight, or having a sibling with autism spectrum disorder. And if the examiner sees any signs of a problem that is mentioned above, a comprehensive diagnostic evaluation is needed. Moving on to the treatment, there are various therapies that are available for the treatment of autism spectrum disorder. One is speech and language therapy, occupational therapy, applied behavior analysis, behavior therapy, and many more other therapies. Early intervention is the key. Early intervention occurs at or before preschool, usually as early as about 2 to 3 years of age. In this period, a young child's brain is still forming, meaning it is more plastic or changeable than that of older ages. And because of this plasticity, the treatments have better chances of being effective in the longer term. Early interventions not only give the child the best start possible, but also the best chance of developing to their full potential. The sooner the child gets help, the greater the chances for learning and progress. So when in doubt, seek professional advice. Your child is doing the best he or she can, given the many challenges he or she faces daily. Be kind to yourself and remember that your child with autism, like all children, is going to grow and develop at his or her own pace. All that a child with autism wants is to be loved and accepted. Please share this video among your friends and family and let's create awareness. Thank you.